My name is Kim Booker, and I'm the Director of Physical Therapy here. I've been a physical therapist for about 20 years. So we can specialize in neurological conditions or degenerative conditions, and that can include stroke, spinal cord injury, brain injury, Parkinson's, MS, just to name a few. We will perform a comprehensive evaluation looking at range of motion, flexibility, strength, balance, how the individual can transfer, which just means how they do getting in and out of their wheelchair if they're using one, or in and out of a chair, in and out of bed, how they're walking, if they're walking with a device or not. Just again, kind of getting a whole view of their whole picture of how they're moving. And then we'll formulate treatment based on those impairments that we find. We're going to be treating one-on-one with each individual, and we're going to also focus on what's important to that person. You know, it's not only the impairments that we find, but maybe what's important to them for their day-to-day functioning. It can be someone that's been referred to us from a physician, but it also can be someone that just wants to come on their own. They don't have to have a referral. And it can be someone that's had a new injury, that's an acute injury, or it can be someone that's had this injury or condition for many years. It doesn't have to be new. They're probably going to see their most progress in the first 6 months to a year after injury, but that doesn't mean that they can't still make progress. Research has shown that they can still make a lot of progress years later. And so, there's always hope to, continue to improve. A lot of it is based on that individual's motivation as well, and their desire to continue to progress. Primarily just working with the Parkinsons in general, just helping them to learn how to move with bigger movements. A lot of times you'll see like a shuffling type ambulation or gait. So trying to help them learn how to take bigger steps so that they aren't at risk for falling. And just being able to move about their environment and do their everyday activities better. But we also can address if they're starting to have neck pain or back pain or other secondary problems related to the Parkinson's. So there's a specific therapy called LSVT Big, and that is something that physical therapists can provide specifically for people with Parkinson's. It's all about moving big, and so it's a real specific protocol. It's for 4 weeks, 4 days a week as well. So it's pretty intensive treatment, but you do have to be a certified clinician to provide that type of therapy, which I have been certified in, and that's something that we can offer here as well. With Parkinson's especially, it's a degenerative condition or progressive condition. So if that individual does not do anything, their condition is going to worsen over time. And so it's really important that they get established with a physical therapist, because they may need at first just a few months or several months of therapy on a regular basis, twice a week, maybe 3 times a week. And then once they get to a level that they can maintain, they can continue exercising on their own, then they don't necessarily have to keep coming for that formal therapy, but they may need to come back for tune-ups or something like that we would call a tune-up, where they might come back every 3 or 4 months or every 6 months just to make sure that they haven't declined in any area, because it's a lot easier to maintain that level of function versus wait until they start falling. So we try to keep therapy fun, of course. We try to get to know, we work with these individuals a lot, a couple times a week for several months, and we really get to know not just them, but about their life, their family. So we try to just make everything individual for that person and what's important to them. We keep the focus on that individual. It's not about us, it's about them. And again, just trying to make goals that are important to them and that they can see the progress too. We can also work with other maybe providers or resources. We can help that individual if they do need a wheelchair. We can help find the right company to work with to get the appropriate chair for them, or if they need a certain assistive device, or if we feel like they also might benefit from counseling or other services. So we can also be an individual that can help them with other resources too. Usually you'll see with, again, Parkinson's specifically, that it's going to be more severe the older they get. So if they can come in sooner, maybe before they even start having a lot of difficulty, that would be even better.